Welcome to the Return to Learn Faculty Town Hall, and thank you for joining us today. I'm Bob Continetti, Senior Associate Vice Chancellor for Academic Affairs, and I'll be the moderator for today's Town Hall. Today we have a group of panelists who are here to answer your questions about the upcoming fall quarter. Some questions were submitted during registration, but please feel free to use the Q&A window in this Zoom session to submit additional questions for our panelists. Due to our time limitations, we're not going to be able to get to all the questions today, but we're going to log them in as they come, and the answers will be posted on the Return to Learn website in the FAQ section. First, I would like to welcome our Chancellor, Pradeep Khosla, for some opening remarks.
Thank you, Bob. Good afternoon, everybody, and welcome. Welcome to what I believe is the third Faculty Town Hall. And I think the whole idea of these Faculty Town Halls is to really keep you all updated about the progress that is being made and where we stand in terms of repopulating our campus. As you know, we've been working for several months now, and we, in this case, is dozens and dozens of people, faculty, staff, student leadership, health sciences faculty and leadership, in terms of thinking about how do we start to repopulate our campus. And we've been developing plans. We have conceptualized the plans, developed the plans, implemented pilots, and now comes the day of the test. Starting this weekend, we're going to be starting to populate our campus. To give you some idea as to who's going to be on campus, during the course of the summer, we've had about 4,500 students on campus, literally throughout the spring and the summer, in that range, between 4,000 and 4,500. Starting tomorrow, or starting on the 19th, we're going to slowly repopulate, and we'll have another additional, maybe about 6,500 to 7,000 undergrads on campus. We have been thinking very diligently about how this is going to happen. They're going to be tested on the way in, they're going to be quarantined for 10 to 14 days, and they're going to be tested on the way out. And we want to make sure that we are creating as safe an environment as we can for our students, our faculty, and our staff. All of these plans have been informed completely by the faculty in health sciences, by multiple of our faculty, and I have great confidence in the team that has developed these plans and is in the process of implementing these plans. To you, the faculty, I want to say thank you very much for being part of this planning process. Thank you, and welcome back from your summer, hopefully a vacation. Typically, I would have said, hope you had a relaxing summer, but in these times, I don't know if anybody's had a relaxing summer or a week or a month. But nonetheless, I'm glad you're all back. And we are here in this all together, making sure that as we reopen our campus, we have minimized, or we have reduced the number of in-person classes. A lot of our classes are remote. We want to give our students a great experience to our best possible ability, and we want to do it safely. So welcome back, and I hope you will be partners in our process of reopening. And let me just say a big thank you to all the people who worked really, really hard in creating the plans and developing the plans and piloting the plans and now in implementing the plans. Thank you beforehand. The world is watching us. A lot of institutions have great hopes. We have great hopes. The world is watching us. And I'm confident that our people, the great work they have done, will achieve great success for the sake of our students. So thank you very much, and hand this over back to Dr. Continetti. Back to you, sir.
Thank you so much, Chancellor Khosla. Now I'd like to welcome the host of today's town hall, our Executive Vice Chancellor for Academic Affairs, Elizabeth Simmons.
Thanks very much, Chancellor Khosla and Senior Associate Vice Chancellor Continetti, for the introduction. It's a great pleasure to join you in welcoming everybody to this session as we discuss the plans for fall quarter, including topics related to teaching, testing capacity, notification systems, and promoting safety on campus. It's been exactly a month since our last Return to Learn Town Hall for faculty, and we really appreciate everybody's patience and ideas and flexibility as the situation related to the global pandemic continues to evolve. I had the opportunity yesterday to hear presentations by a number of faculty who have been leaders in educational innovation in these recent months, and these were just tremendously impressive. I'd like to acknowledge here the creative work of the faculty as a whole on behalf of our students and their widespread efforts to promote educational innovation and access across campus. These efforts are making a tremendous impact and are deeply appreciated. So the panelists and I look forward also to addressing many of your questions today. I encourage you also to refer to the Return to Learn website, returntolearn.ucsd.edu, and also the newly relaunched Keep Teaching website, keepteaching.ucsd.edu, to stay up to date about the latest campus developments. And now I'd like to turn the mic over to our new Academic Senate Chair, my colleague, Dr. Stephen Constable, to say a few words.
Thank you, EVC Simmons. As advertised, I'm your new chair of the San Diego Division of the Academic Senate. I'd like to give a big thanks to outgoing chair Mary Pat Kaur for her excellent work this past year. Shared governance has never been more important than in these difficult times. Last week, I distributed a newsletter outlining some of the issues that the Academic Senate has been working on during the summer. If you missed it, you can find the newsletter on the Senate web pages at senate.ucsd.edu. I know that some of you would prefer a more interactive format for these town halls, but the two previous Senate admin town halls had up to 400 participants, forcing us to the webinar format. However, the questions entered into the Q&A channel during those town halls have been answered, and these answers have been posted on the Senate webpage. And today's questions will be answered and similarly posted. So with that, I'll hand the microphone back to Dr. Continetti.
Thank you, Senate Chair Constable. So today we're going to be having several presentations before we get to the Q&A portion of the town hall to bring you up to date on the current status of our Return to Learn plans. First of these presentations, I would like to introduce Dr. Carlos Jensen. He's our Associate Vice Chancellor for Educational Innovation, and he's going to talk about those recent updates to the plans for fall instruction.
Thank you, Dr. Continetti. So these numbers are in flux as always, up until the very last minute, but the high level update is that as of this week, we project having about 15,000 students join us in person. 2/3 of those students will join us because campus will be their home. They will be living in the residences, both graduate and undergraduate students. About half of the students will also be engaging, 1/3 of the students will be taking an in-person class. When it comes to undergraduate students, about 1/4 of undergraduate students are going to do one in-person course, and about 6% are going to do more than one in-person course. We expect to have a little over half of the graduate students back on campus. Those numbers are a little uncertain as some of them are included in research plans, but they're not registered for any in-person classes. So we project that that number may actually be a lower bound. In these graphics underneath, you can see the distribution of who's living on campus, who's taking classes. I'll point out that we have a good number of students who are going to be living on campus, but are not going to be taking in-person classes. And these are students for whom the accommodations and the facilities that we provide are essential to their success as students. Next. To make the in-person classes as safe as possible and to accommodate the needs of faculty, there's a couple of things that we're rolling out. The first is that anyone who's teaching an in-person class will be issued a personal lapel microphone. There's no need to request this. These will be handed out first day of class for in-person sessions. If there are TAs or instructional assistants, et cetera, that need these as well, they can be requested and we have spares on hand. We are working as diligently as we can to stand up outdoor teaching opportunities. We recently announced that we will have 4 tents. There's a chance those will not be available on the first day of class, but they will come online shortly after. And these are primarily meant for faculty who are currently scheduled to teach in person during the fall, and we can shift your in-person class to an outdoor setting for you to try out, or if you choose. These are also here for any other faculty who want to test this out for future terms and decide whether this is a useful opportunity or a useful option for them. We will have 4 specially prepared remote teaching classrooms. We know that a lot of faculty have challenges in teaching remotely from home, either bandwidth, equipment, distractions, family commitments, etc. These rooms will be bookable through ETS. And you can go there and pre-record a lecture, or you can do a live session. They'll also be available to TAs and instructional assistants, office hours, things like that. And then we're going to do our best to promote community and sharing of best practices. We're going to have a number of different events and opportunities. The first is next week, the EdTech Showcase, which is put together by ETS and Digital Learning Hub. Going to share best practices for how to create engaging remote classes. And as EVC Simmons shared, we have a new relaunched Keep Teaching website that now has a lot of examples from our faculty from spring and from summer, great examples on how to create engaging classes and work with your students. Thank you.
Thank you so much, Dr. Jensen, for the update on the Return to Learn teaching plan. Next, we have Dr. Chip Schooley. He's a professor of medicine in the Division of Infectious Diseases and Global Public Health and an expert on the coronavirus, and is going to brief us on updates to our testing capacity and the testing dashboard.
Thanks very much, Bob. This is an area that has been rapidly evolving from early March, when we were able to do only 20 tests a day for the entire health system, to one now in which we have 2 laboratories, one within the hospital, the CALM lab, and another, the Excite lab, that is a collaboration of Rob Knight, Jean Yeo, and Louise Laurent, now CLIA certified and located on campus, both able to provide support for coronavirus surveillance here on the UC San Diego campus. We have done calculations based on mathematical modeling that you've heard from Natasha Martin earlier about the number of tests we'd need to have capacity to do at various testing densities, and also have room for surge capacity as needed. And without going into all of the data in front of you, you can see that we are calculating that based on twice monthly testing for every student living on campus or coming to campus, plus our faculty and staff on campus, 2,000 daily tests would easily do it. And with the combination of the Excite lab and the CLIA lab now coming on board, we are excess of that. One of the problems with one or the other, and should keep us in good stead throughout the fall. Next. As we've been shifting from the CALM lab to the Excite lab, we're working on augmenting the dashboard in a way that we can provide more data to you moving forward. This is the current dashboard. It looks very much like Duke's dashboard in the sense that there is a initial panel that shows all the testing from the beginning of the epidemic. And you can see that over this period of time between the students, campus employees, and health employees, we've tested nearly 25,000 people, and the positive test rate in these 3 populations ranges from 0.7 to 1.2%, which has been consistently well below the San Diego county testing positivity rate throughout the summer, and that has not changed. Next. We also, the next panel on this testing website includes weekly data broken down into each of the 3 different buckets, students, campus employees, and health employees, showing you the percent positive tests over the previous week that will be, that can then be traced back if you just go panel to panel to understand trends in each of these populations. What we'll be doing as we develop more automation from the new laboratory to the campus dashboard is to be able to provide more rapidly accessible data and to make it easier to access. The bottom line, though, is that the dashboard has been very easy to follow so far, and it really has documented an extremely low positivity rate throughout the spring and for the populations here on campus. Thank you.
Thank you so much, Dr. Schooley, for the update on the rapidly developing area of SARS-CoV-2 COVID testing and the transparency we're going to have through the dashboard. Next, we're going to have Dr. Angela Scioscia, Interim Executive Director of Student Health and Wellness.
Hi, I'm going to speak a little to our viral detection plan and care for our students as well. So our students, as well as everyone else on campus, are involved in the detection through the daily screening process. The important part about this is you can get same-day testing very quickly and results back in 24 to 36 hours. And our students have already been engaged in this process. Even those that haven't arrived yet started their screening in advance of their arrival to make sure they would get care before arriving if they in fact were ill. And the other thing is the viral testing through the wastewater. Many of you are aware that we had Labor Day weekend. We had our first episode where we had a positive signal and we're able to rapidly test hundreds of individuals and identify 2 individuals asymptomatically shedding virus and get them under care. Next slide, please. So the next part of this is this periodic process of looking for individuals who are asymptomatic and shedding virus without their awareness. For faculty and staff, this is on a voluntary basis. We're recommending that they consider testing at least twice a month. For the students, this will be a mandatory process. And they will be testing twice a month at intervals that are no less than 12 days and no greater than 16 days. Why did we choose this for the student population? It's because this disease, this virus has a much higher asymptomatic rate in the younger adult population, and they've had a higher positivity in our community. This applies to all of our students who are coming onto campus for any function that includes education, co-curricular activities, social recreational activities, athletics. It is not, though, for a student who is coming purely for an employment purpose. We began some testing as well, for student employees over the summer. We expanded that to our graduates who were coming onto campus in mid-August on new arrivals, and they test within 48 hours. And we also added testing for our off-campus student population, leveraging our mass testing site, which we opened in September and will remain open for the month, which is off of North Torrey Pines. Some of you may have driven by and seen the tents. We're able to test hundreds of students a day. So we began with our off-campus student population, and we'll be converting tomorrow to the undergraduate move-in, which we spoke about. We're going to have about 6,500 to 6,700 new individuals joining our campus. I'm going to go a little more detail to how we're planning for the undergraduates. Next slide. We adjusted this plan when we saw what was happening at some other campuses. We always had an initial plan to test on arrival, but when we saw other campuses struggling, we realized we had to tighten this plan up a lot. And this structure that we have of double testing is really taking into account that an individual who's exposed shortly before arriving on campus is in a 14-day window in which they could develop asymptomatic shedding or they could develop symptoms. So we will test on arrival. Positive students will get the results within the next day. Now, when they test and they come onto campus, first of all, they'll be sure that they're masking without symptoms, but they will go into a sequestered phase. And in this phase, when they're in their residential units, they will be masked at all times except when they're in their bedroom or in the shower. They will be able to go and grab meals in the residential area. They'll be able to go out of the building, of course, being masked, but within the unit, they will continue to be masked. They will stay in this sequestered period until all the individuals who are moving into that residential apartment or suite have arrived on site and a 12-day period has passed. This allows for the very last person to arrive to have had a quarantine period from exposure to declaration of symptoms or asymptomatic shedding, and then to be retested. So at that point, they will have a second test. So then if everyone is testing negative, they haven't developed symptoms. Of course, if they develop symptoms at any time, individuals are tested. If they're positive, they move to isolation. So assuming none of the students in the unit have had any symptoms and both their tests are negative, they move into phase 2. And in phase 2, in their residential units, they no longer need to mask within that space. It gives them a little more freedom within the residential unit, apartment or a suite, to not be masked all the time. So we're very optimistic. This is what the case we'll see with most of the units. Now, I should say, we do expect to see some students who will arrive with asymptomatic shedding. We've seen this from other sister campuses, as well as what we've seen on the grads that came a little early and the RAs that came earlier. A couple of them actually were asymptomatic shedding, and we were able to diagnose and provide them care and isolation very early. So we will see, you'll see on the dashboard as it comes out, you're going to start to see some increase in activity as we pick up these asymptomatic cases. So don't be surprised by that. It's fully expected, and we're prepared to care for these students. So on the next slide, I'd like to talk a little bit about how we're caring for the students who are impacted by this virus. Those students who have a diagnosis and are in isolation, or those who have been exposed or in quarantine, will see checkups by the student health providers. Those that have positive diagnosis get a check-in every day to make sure they're doing well. At the time they check in, they will also be checking if they need other services, including mental health support. They will be asking permission to share their situation with the Dean for Student Affairs, or on the graduate side, similarly a link, so that if they need other wraparound or academic support, we will be able to provide that for the students. When they are in isolation on campus or quarantine on campus, they will have their meals delivered right to them. They also get some snacks. So we have quite a bit of support for these students. We made the decision today that we will be offering this to our students who live off campus, who are unable to safely isolate or quarantine in their off-campus residential space. Because we know that the off-campus students actually in most communities, and we've seen a little bit of this as well in our own community this summer, they seem to have a greater chance of being exposed to this virus and developing problems. So we wanted to create a safe way to care for those students when they couldn't do this safely for themselves in the residential off-campus location. We have tight case investigation and contact tracing, which is a collaboration between the Student Health Service as well as the Public Health School. And that's going very smoothly. So we get case investigation within 24 hours as well as contact tracing, and we reach out to all of our students. So thank you, and I'll turn it over.
Thank you, Dr. Scioscia, for the update on a critical part of our Return to Learn plan. Next, we're going to hear from Dr. Chris Longhurst, Chief Information Officer and Associate Chief Medical Officer for UC San Diego Health, and he's going to tell us about an important new development, and that is UC San Diego's participation in the state's exposure notification system pilot. Chris.
Thank you, Bob. This is some really exciting news. Hopefully you saw the announcement that went out from our Chancellor last Friday, when the state announced that UC San Diego and UC San Francisco had been selected to help to pilot this technology. There are a few key things about this pilot that are really important to understand. The first is it's completely voluntary. The second is that it's completely privacy preserving. So we, UC San Diego, have no idea who's participating and no idea who's getting notifications. And the third is that this is all about anonymous exposure notification. It's really important to understand that there have been over 42,000 cases of COVID just in San Diego County alone. And the majority of those cases, we don't know where they got it. We don't know where people are getting infected. And so on the next slide, there's a cartoon kind of illustrating how this technology works. This is available from the public FAQ, and it basically describes how Alice and Bob are sitting on a park bench, and Alice might be a student or a faculty member, Bob might be a student or a staff member, and they might be using Android and iPhones. It doesn't matter, they'll talk to each other. They exchange keys if they're within 6 feet for more than 10 minutes. And in this example, Bob unfortunately gets diagnosed by the UC San Diego Health testing line with COVID. And at that time, he's offered a 6-digit key that he can voluntarily enter into the app to alert people with whom he's been in close proximity in the previous 14 days that he may have exposed them to COVID. Now, the alert that's received on the next slide is anonymous. So you can see Alice is hanging out and gets this alert saying you may have been exposed or in contact with somebody who was recently diagnosed with COVID. directs them to our UC San Diego Return to Learn website, where there'll be information on next steps and appropriate protocols for quarantining and testing. Many other countries have implemented this technology. Switzerland just published some of their data showing that, in fact, the positive predictive value of these alerts is higher, is clearly at higher risk. And so this is exactly what we want, is the kind of technology that can help make it possible to keep an outbreak from becoming, 14 or 40 people, but limit it to 4 people, because we're getting those exposure notifications out quickly. And then on the final slide, just kind of a summary. We're planning for go live next week. We're starting with a soft launch Monday, Tuesday, and Wednesday. We're anticipating making this available to all students, staff, and faculty across the university on Thursday. Our campus marketing communications team has developed a terrific communications plan, so you'll be hearing a lot more about this. But the bottom line is that anybody with a ucsd.edu email address will be able to participate in the pilot. More instructions will be forthcoming, and the notification process will be embedded in both the UC San Diego Health and the student health testing workflows. So I'll stop there, and I expect there'll be some questions.
Thank you, Dr. Longhurst, for that update. We've heard about the health science elements of Return to Learn, but the social aspects are absolutely critical. And we're going to hear next from Vice Chancellor for Student Affairs, Alysson Satterlund, who's going to speak to that.
Thank you so much, Dr. Continetti. So as challenging as the circumstances are for our staff and our faculty, our students share in this challenge as well. And we are still quite intentional about providing a proper set of engagement opportunities for our students remotely. So this year, what we hope will be a tradition moving forward, several members of our teams across the colleges, the graduate division, student life, summer session, and many partners across our academic departments as well came together to launch TRITON Weeks of Welcome, which is a showcase of hundreds of remote and virtual activities to engage our students as they start to move in this weekend and over the next couple of weeks as part of week 0, as well as week 1 of our fall quarter. We have convocation as an important part of this event. We have our virtual student club fair. We will have a number of activities unique to the colleges, so our colleges and their unique cultures can also be lifted up. We have provided here in this presentation also the link to TWOW. There will be opportunities to welcome new faculty as well. And then I wanted to highlight the work of the Virtual Student Union, which is where we have been inviting departments, programs, student clubs and organizations, community centers, and others to identify programs and events that they'd like to make available to student clubs and organizations, to all of our individual students, graduate and undergraduate. And these are available via the UC San Diego app for our students as well. So again, working to ensure that though the circumstances are not ideal, that our students have opportunity to build community, to learn from one another, to engage in dialogue, and to support the elements of the out-of-classroom experience that we know are so critical to our students' development and success. Next slide, please. Also complementary to our TRITON Weeks of Welcome effort, I wanted to share with you some of the work that's been happening across our campus, particularly to support our harm reduction behaviors across our student communities. Again, focused on first and foremost prevention of the spread of COVID-19, how to also keep ourselves safe, but also our community members, and inviting students to continue both personal commitment to this effort, but also knowing that the personal commitments they make serve the community as well. Of course, we will have continued no-cost testing for our students every 2 weeks. This also includes our extension students and our students who live off campus. And we launched this week, really in partnership with our student leadership, videos that our students had developed around why is it important to do the daily symptom screener, and what choices are you making with your friends to make our community safer. This coming week, we'll be launching Mythbusters around COVID-19 that are specific to our undergraduate and graduate student population. And we also will be launching our TRITON Health Ambassadors program tomorrow. We have over 150 undergraduates and graduate students who will be working 10 hours a week in zones across campus and along the neighborhood zones as well as the beach to provide education around COVID-19 healthy activities, to make available free masks for our students who may not have one with them or may have lost one, and really to engage in friendly compliance. And then also to do what our public health faculty that we've been working with have asked us to do, is to really be curious and compassionate. So for example, our Triton Health ambassadors will help us identify, why do we always have groups of students without masks in one particular location? And then how can we adjust our prevention, risk mitigation, and communication efforts to eliminate that particular gathering at that particular time? And then of course, we work to support our students who are in isolation or quarantine as we like to call. We have a group of volunteers across the campus who are working specifically to provide programs for our students in isolation and making regular phone calls and being connected and engaged with our students. And we launched today a video and communication from me to all of our students, graduate and undergraduates, and also to their parents and loved ones, reiterating expectations as well as resources, because we know if we can't support our students to be successful, then we won't be able to be successful. And then finally, we'll be launching a student leadership summit the first week of the fall quarter, specifically dedicated to community health in order to support the coalition around this particular effort that's so important to our student leaders and our student community members. So thank you for the opportunity to share. Bob?
Thank you, Vice Chancellor Satterlund. Next, we're going to hear from Vice Chancellor of Resource Management and Planning, Gary Matthews, on how to make the campus a safe place to teach.
Good afternoon, all. I greatly appreciate the opportunity to address you, and certainly over the last several months, we've had a variety of different signs that have gone up. In the last several hours, we've even had banners on bridges. And we're really trying to get the message out that, one, you wear a mask, it's required, and also to provide some pretty good directions in terms of what we should all do in terms of keeping ourselves safe. Washing our hands, making sure that if we touch surfaces, we clean them, and most importantly, that there are also folks on campus 24/7 at the Emergency Operations Center who can help us throughout this serious issue. Next slide. So while they wait for the next slide, what's important is also that we have developed several changes in our cleaning approaches. Could we bring that? Thank you. So hand sanitizers have been mounted at major entrances to core buildings, primarily classrooms that we're going to be using throughout the fall, and these will be maintained and refilled daily. Could you go back one slide, please? And with that, we will also have, wherever possible, installed hands-free motion-activated building entrances, so you don't have to pull the door. Our approach is really to try to reduce the touch points and hopefully to have hands-free access wherever possible into buildings, restrooms. And we've also deactivated drinking fountains. We found that there were too many issues with passage of potential virus. And what we've also done, though, is we've ensured that the bottle refill stations are available, and we will maintain them and sanitize them throughout the day. We're also going to make sure that cleaning and disinfecting is done at our typical level, and as we progress and the campus is repopulated, we will be bringing in additional staff to increase our cleaning opportunities. Next slide, please. Some of the things that we've also done throughout the last 6 months is we've really looked at our building systems. And most importantly, I want to stress that we've been looking at best practices, developing best practices, and developing with the best of the best our own faculty, researchers, clinicians. So we've done great things in terms of identifying how we can manage our HVAC systems, heating, ventilation, and air conditioning. We've been flushing building systems to make sure that they're clean. Buildings were never designed to sit vacant for 5 or 6 months, and things can build up in building systems. So we've been flushing those systems, and the ventilation systems have been adjusted to operate with 100% outside fresh air in most of the large buildings that can accommodate those types of fan cycles. And we're also looking at some other issues within smaller buildings in terms of airflow. We've also cleaned the fleet. We will be cleaning the fleet in terms of our shuttles, our vans. We are transporting folks across the campus now in our mobility arts, and we will follow a pretty rigid sanitation protocol as we move forward. Next slide, please. So one of the things that we've done is to try to look at how we reduce the density on campus. And many of you have heard that we will still have remote learning. We will have those working from home to remain at home as they can. But we're also looking at what we're calling a curbside pickup service for some of our resource management and planning organizations. So bookstore, imprints, public records, CPRA, and we're partnering with the library to provide a pickup service at our Osler garage. So rather than trying to find a parking space, going to the Price Center or another building, going into an office where you've got staff working, we've come up with the initial idea and design to have a curbside pickup. We'll bring it out to your car. You can either do a drive-through, or there will be some hot spots to park. And we think that this will hopefully provide, again, less potential for spread of the virus. And most importantly, it gives people quick access to the things they really need to do to pick up. Next slide, please. So the next slide is really focused on our early education and childhood centers. And one of the things that has happened is we have begun to develop plans to open towards the end of this month, roughly September 28th. We have to still iron out a few things, and most importantly, it depends on what happens with the county in terms of its guidelines. If we slip into purple, there may be changes. But we're focused on bringing back as many of the children as possible. We've done some minor modifications to the facility so that the children will be in pods, they'll be in bubbles, 10 children to 2 to 3 teachers who will be assigned to that class and only that class. There'll be an emphasis on outdoor education, and we really do want the children, as well as many of the rest of us, to be outside as often as possible, because we feel that that's a better environment, at least until the weather changes. But then again, we have great weather in San Diego, so we should be fine. We're really trying to make sure that we support families that have specific needs. So we've adjusted our program slightly, so we have a full day indoor and outdoor program. We've also developed a part-day outdoor camp for preschoolers, and we're also looking at the development of a school-age program for children aged 5 to 8, and we're waiting for a waiver from the Department of Social Services for that. We're also continuing to provide some distance learning for the little ones, and that's been quite successful over the last several months. I believe that's my last slide. Thank you very much.
All right, thank you, Vice Chancellor Matthews, and all of our presenters today. During registration, all attendees had an opportunity to submit questions for the panelists to answer, and we've selected some of the most popular ones that will be addressed by the panel today. And of course, more questions have been coming in on the Q&A. I encourage you to continue to submit new questions to the Q&A, and those we don't get to will be answered on an FAQ posted on the Return to Learn website after the town hall. So now I'd like to welcome all of the panelists to turn on their cameras and join us for answering questions, as we do have a number of questions in the queue. The first question, and while this is in view of the time, I'll go ahead and start with the first question. It's for EVC Simmons and Dr. Jensen. Will faculty be able to choose whether they teach remotely or in person for the winter quarter?
Yes.
Yes.
There you go. That's a straightforward one-word answer. So that's very clear that people will have the opportunity to make that choice in the winter quarter as well. So that can allay some concerns. Panelists, next question is then for Dr. Schooley and Dr. Scioscia. Can the public COVID dashboard data be presented graphically so the trends, daily or weekly, can be seen more easily?
Same answer, yes. No, we're really working on making it easier to follow, and have had to get the data streams into the dashboard nailed down first. We're also trying to resource the dashboard construction a bit better than it's been resourced so far. It's a work in progress, and we'd appreciate feedback as go ahead so that people can easily see what they're looking at.
Okay, thank you. That's very clear as well. The next question is for Vice Chancellor Satterlund. How will UCSD prevent students from gathering or attending large parties? A challenge we know many universities have already been working on addressing.
Oh, thanks, Bob. So, you know, this is a very important question, and I know how stressful it is for neighbors and faculty and staff, and certainly for our students as well, who were holding to this very important standard. So first, I just want to reiterate that we will certainly have gatherings, just as our campus's partners and peers all across the country have. Developmentally, this is a very strong desire for our students to have peer approval and connect with peers. We also know developmentally that our students can make good and important critical decisions. And so we're also supporting our students in doing this. Specifically, if we are made aware of an off-campus gathering, we will activate our COVID-19 monitoring team. We will publicly communicate the need for symptom checking and testing for attendees, as we won't know everybody who was in attendance, and we want to think about public health first. And we'll begin, of course, the tracing and tracking affiliated with the testing results. Of course, as we do in any student conduct matter, we privately acknowledge those who have come forward to support our investigation and our due process efforts. We'll continue to gather facts, and we will apply our newly modified interim COVID-19 student conduct policy, which we have been sharing with students via the Return to Learn site, and which we sent to all of our 40,000 plus undergraduate and graduate students today, regardless of whether they're in San Diego or out of San Diego, or whether they'll be with us learning on campus. We will also implement what we refer to as a restorative justice model. It's an opportunity for students to take responsibility and get back to the community. If a student organization is the one who's hosting a party or gathering, we'll of course issue a cease and desist so we can immediately begin with a review of the conduct process. If it's individuals, we will proceed with education, probation, suspension, or interim suspension or dismissal in that order. And we'll most importantly continue to use our peer engagement models and the work of our advisors who are deeply connected with our students as well. And we'll also leverage the important relationships that our students have with their loved ones. Parents and families also receive notice of the expectations, and most importantly, continue to provide support for our students, because we know this will be a challenge. But we've prepared, and we understand that we will need to exercise this student code of conduct policy rigorously, in addition to providing our students with support.
Vice Chancellor Satterlund, could you just maybe expand on that a bit, the measures in place to remove students who fail to comply with county or university policies?
So we have to abide by due process, which we would want for all of us in any circumstance. So let's say we were to receive a report today of a party in a local neighborhood. We would proceed immediately with contacting those students after noticing all of the student community that if they were in attendance to this gathering in this area, that they should come in for COVID-19 testing right away. Once we were in touch with the students who hosted that party via a landlord or a neighbor, we'll use the investigation tools that we have either through our relationships with San Diego Police or with UC San Diego or with our club and organization advisors. We will work with our students to, again, start from an educational perspective, and if we need to, move to, as I mentioned earlier, suspension, probation, dismissal, or for egregious misbehavior, expulsion.
Thank you. The next question is for EVC Simmons, and it's a fundamental question that many have asked, and that is, why has UC San Diego decided to offer in-person instruction this fall?
That's a great question. It really goes to the heart of Return to Learn. Why do we have Return to Learn? And the answer is, we know that this virus is going to be with us for some time. We have to be flexible. We have to adapt. We have to learn how to operate as a full university in this new normal. And we do that by gradually shifting to allow more in-person engagement of all kinds. Teaching, scholarship, patient care, a whole variety of things. Now, for some instructors of record and for some teaching assistants, teaching in person is an important part of how they structure their courses and their interactions with students. And we want them to have the option to selectively use in-person teaching as part of their approach, where that's the most effective thing to do. Of course, thinking of courses that perhaps have lab elements or studio elements or field research or other experiential elements, you can see where that would be important. We also know that our own students have expressed great enthusiasm for a campus-based experience, including in-person and hybrid learning opportunities. And that's why over 6,000 undergraduates have elected to live on campus this fall. They're starting to move in. And while why thousands of others who will live off campus are planning to take at least one course in person, as in the data that ABC Jensen showed us a little bit earlier. And for those students, even if the majority of their courses are online, they find that this will give them the opportunity to engage with small groups of classmates in person, to get involved in research, to undertake some of the broader personal development that life on a college campus allows. And bringing students back to campus in controlled numbers, in a controlled manner, with a lot of safeguards and a lot of monitoring. Our goal is to offer that rich educational experience and that rigorous educational experience that we pride ourselves on at UC San Diego, while reducing and mitigating risk. So we're working in this balancing act, trying to do the very best for our students, trying to allow our faculty and teaching assistants the flexibility to do their very best and most creative work, and doing it in the safest possible way and learning how to do that together. That's why we have Return to Learn.
Thank you. Thank you for that clear statement, EVC Simmons. Next question is more technical for Dr. Scioscia. If someone in my in-person class tests positive, will I be informed by the university? How should I handle that if it happens?
You may or may not be informed. I'll tell you a couple scenarios. So when this student health provider speaks with a student, they will ask permission to let the Dean for Student Affairs or the Graduate Connection Dean if they can share the information. And based on that, there will be a conversation with that student. And they may ask, please let my faculty and advisors know of my situation because they may need academic accommodation. So that could happen. You could see a scenario though where a student who is totally remote learning and asymptomatic and feeling great is able to continue in everything they're doing, and therefore they've chosen not to let anyone know. And there really is no need to know. And so you might not know about that student. Another scenario could be that you met with that student and you, for whatever reason, had a suboptimal decision-making and you both took your masks off and you had a half-hour conversation about a project you're working on within 6 feet. In that case, you'd been an exposed individual and you would be notified through the contact tracing and case investigation process so that you could take care of yourself. So there are a number of ways that you might know, but it is conceivable you would not know and wouldn't really have a great need to know just because the student is positive. Okay, I hope that helps.
Thank you. Yeah, the complex privacy elements of this, this whole matter. The next question is for either EVC Simmons or ABC Jensen, and that is, what are the expectations for using synchronous versus asynchronous teaching this fall, and what is the underlying reasoning?
So let me start off with a few general remarks, and then I think ABC Jensen can fill in with some additional specifics. So the general answer is that we start from our campus dedication to equity and access. The premise that we need to structure our courses so that all of the students in them can access course materials and can participate as fully as possible in the course. Now, some students we know are going to have unexpected challenges that crop up for them, unstable internet, a computer that breaks down. Maybe they'll have lack of a private space from which to attend class, depending on their economic situation and their living environment. Some may have a job schedule in order that changes abruptly, and they need that job to afford to even be in college. Some may become ill. Some may simply be in another time zone as well, of course, as we're aware. And so synchronous elements of a course can be extremely powerful for students' learning. There's no question of that. And so faculty can use synchronous elements of a course, an in-person course or a remote course. But when the instructor or the TA uses a synchronous element, they need to make sure that there is a way for a student who was unable to be present at that moment to not only get the information, but to have an educationally equivalent experience. So if what the students missed was more of a lecture, clearly if you've recorded the lecture and if you've podcasted it and posted that, that's fine. If there's something more interactive that's happened, you need to figure out how to make that kind of experience also available to those who have to participate asynchronously for any of a variety of reasons. That's the general idea and the general reasoning. And I think that ABC Jensen can probably give a couple other examples of what one might do and resources available.
Thank you, ABC Simmons. And that's exactly right. It's not that we want to discourage having synchronous engagement with the students. It's a very powerful and flexible tool, but we just need to make sure that there are alternatives for the students for whom synchronous participation is not an option. So an example is if you have a discussion or a discussion section in your class, the students who are able to participate synchronously, absolutely engage them in that discussion. Students who can't participate synchronously, you can, for instance, have them review or argue pros and cons of the arguments presented in the discussion, or to do some additional research and provide sources or counterpoints from literature, current events, what have you. Where it gets a little bit more tricky is when we have lab courses, then you really do need to think about a fully equivalent type of experience. And we're all struggling with that right now. But keep in mind that the experience doesn't have to be the same. Educationally, learning-wise, it has to be equivalent. And so I think this is where we have a lot of challenges with the course redesigns where folks are kind of locked into, it has to be the same for everybody.
Thank you. Thank you both. The next question is for Vice Chancellor Satterlund, Dean Moore, and Dean Antony. Are there prescribed steps a faculty member should follow if a student is not wearing a mask in the classroom?
So Bob, we have put together an intervention tool that is available on the Return to Learn website for faculty, staff, students, and community members who may meet somebody on campus who's supposed to be wearing a face covering and they aren't. So we'll make sure that the organizers of this town hall have that available. But in short, a phone call to EH&S will provide a remedy, as well as some guided language that we provided in that intervention tool. I don't know if Jim or John would like to add anything else.
Just that if a faculty member is confronted with this type of situation, they do not need to continue the class in a way that they feel is putting themselves or the other students at risk. So they always have the option of pausing the class and waiting till the situation is resolved. The other thing that's interesting that we have been hearing from some of the other universities that have already begun instruction is that this seems to be not an issue. It does seem to be the case that across the nation, students in class are wearing masks. So we're hoping that that continues to be the same. Nevertheless, we do have a very articulated protocol for handling cases where that's not the case.
Thank you, John. Anything to add, Dean Antony? No. Yeah, I think that pretty well covered that. The next question is for EBC Simmons. Are there any plans for extending the tenure clock for ladder rank faculty hired after June 30th, 2020?
Not at this moment. We'll see what develops in the future, but not at this moment. And I don't think that other UCs are doing that either at this time.
Thank you. Next question is for ABC Jensen. Can you please provide an update on the plan for the use of the outdoor classrooms? I think you your presentation addressed this to some extent, but maybe you would like to expand a little.
So we're very excited about the possibility of the outdoor classrooms. These will be, I think, really wonderful spaces, taking advantage of our wonderful weather here. These are going to be large tents. They're dimensioned to accommodate up to 70 people, even though we won't allow occupancy of more than 50, with 6-foot distancing between each person. We'll have full AV support, so wireless, microphones, speakers, large screen displays, whiteboards, etc. You'll be able to Zoom and record all the lectures, one wall, 3 open sides. But this is all coming together as we speak, and so we'll see if it's as wonderful as we imagine it.
Thank you, ABC Jensen. This is probably the last question, and it's an important one, and it's coming back to EVC Simmons. And the question is, what are the key aspects of UC San Diego's preparations for return to learn that reflect lessons that have been learned from peer institutions that have preceded us this fall?
Thanks for asking. I was at a meeting of the AAU provosts this Monday, and that was a topic of conversation. And there were several different things of particular note. One, Dean Moore has alluded to, that there are some things that we were all concerned might happen that in fact have not been transpiring. And I should note that most of our AAU peers are semester schools, so they've been in session for several weeks. So students are in fact wearing their masks to class without fuss, and transmission of COVID-19 is not happening in classrooms. When it happens, it's happening in other settings. But things that our peers were saying had been valuable for them was an interesting list for me to hear, because it turns out that they are all things that we were already doing. So the things that they had found most valuable were having a medical school and a health system right there on site with infectious disease and public health expertise. So we know we have that. Requiring surveillance testing with quick turnaround. We're doing that. An exposure notification app to augment contact tracing, because people have greater or lesser compliance with contact tracing, but the exposure notification app can help get around that. Residence halls with all singles and strictly a suite or apartment configuration. We have that. Large capacity for quarantine or isolation beds for students from on campus or from off campus as needed. Ability to provide meals and medical care and other kinds of support to quarantine students so they don't feel abandoned or like they're in surroundings that are really not very comfortable. We've taken care of those things, and we've been doing that all the spring and summer, so we have a lot of practice. Good relations with the county public health department. We're in constant conversation with them. Having student health ambassadors and updating the student conduct policy in exactly the ways that VCSA Satterlund has already described, and following through and making sure that if people are not following the rules to protect the community, that there are consequences. So all of these things that our peers were talking about are things that we were already doing or already had planned, and I think that's a really nice place to be.
Thank you, EVC Simmons. We're going to squeeze in one more quick question in the spirit of communication, and that is to ABC Jensen. How are large undergraduate courses going to be handled, the 300 plus courses? Will we have in-person office hours and study sections?
So every large course that wanted to have an in-person element had to be broken down into sections of no more than 50. Now, if you want to have office hours and you want to have study sections, et cetera, outside of those meeting times, those really need to be treated with the same limitations as we do any in-person class. We will have, as I mentioned, some of the outdoor spaces that will allow some flexibility when it comes to kind of these impromptu type of gatherings. In addition to the 4 large teaching tents, we'll have a number of smaller support tents that could be used for office hours or for something like this. The best advice that I can give is to really treat office hours and those kind of interactions the same way that we treat a lot of our current engagements, which is appointments and scheduled small groups if you need to do those in person. What you don't want to do is set up a situation where inadvertently you could have large crowds showing up unintended.
Thank you, Carlos. Well, I am afraid that is all the time we have for today. I'd really like to thank all the faculty who attended, all the questions they have brought to us, the presentations that we had, and all the panelists for their effort in communicating and bringing us all together in this critical period as we begin the fall quarter in Return to Learn. We're going to be working to answer everyone's questions and posting responses on the Return to Learn website, as I noted. And we also encourage you to complete the post-event survey that's going to be sent out shortly, because we're trying to learn how to improve this communication in this new world we're in. And with that, this concludes this Return to Learn Faculty Town Hall. So thank you. Hope to see you soon on campus.